I hadn't felt like myself in a long time. I didn't enjoy the things I used to. I just didn't know what the problem was. A few of my friends had suggested I see a counselor, but I shook it off, hoping things would get better on their own. While I knew they were probably right, it was hard to imagine myself in counseling because I didn't know what to expect. I didn't want to lie on anybody's big couch. And isn't counseling just for crazy people? Am I crazy? I'm not crazy. I wondered if the counselor would judge me or if my friends and family would find out. I tried talking to friends and family about it. I tried to make more time for things I enjoyed. But I knew something was off, and I really had no idea what it was or how to fix it. I even tried Googling some of my symptoms to see if I could figure it out, but as time passed, I was feeling worse all the time. It even began to affect other areas of my life. My grades even started to suffer. I finally accepted that everything I was trying wouldn't work. I needed something more. So I made the call. The receptionist was friendly and helped find time that worked with my class schedule. I thought I would be seeing someone right away, so I was surprised when she said there was a wait list. At first I thought that the wait was excessive, but after doing some searching online, I found out that it was standard procedure for most healthcare services offered at a university. It also made me think, hey, if there's a wait list, there must be a lot of people going to counseling too. I guess more people go than I thought. The receptionist said if it was urgent, I could come in right away for a same-day appointment. I considered my options and decided that I could wait. As the date of my appointment grew nearer, that's when my nerves really started to get the best of me. I started wondering, what's going to happen in the appointment? What will they ask me? Will they give me advice or blame me for causing my problems? I wonder if other people ever have similar issues, or is it just me? I didn't want to be judged by the therapist. What if they don't like me? What if I don't like them? Will they give me medication? Do I even want medication? I had no idea what to expect from counseling, so it made the wait a bit difficult. If you're considering counseling and not sure what to expect, take it from me. It's normal to be anxious. The day of my appointment had arrived. When I first walked in, I was asked to fill out some paperwork before meeting with my counselor. It had questions about my symptoms and my mental health and medical history. Then, a few minutes later, I finally met with Dr. S. Turns out, she was really chill for a doctor. After she introduced herself, she informed me that everything we were going to talk about would be completely confidential, with a few exceptions, which we discussed until I felt comfortable. She also said that if we see each other on campus, she wouldn't say hello if I didn't want her to, unless I initiated the communication. We talked about why I came in. I told her that I hadn't been feeling like myself lately, and I didn't know why. I talked about how I couldn't focus in school, how I was feeling sad and angry at times for no reason, and that I was exhausted. She asked me questions about my family, my friends, any clubs or organizations I was a part of. She asked me about my childhood, any medications I'd ever taken. She also asked if I had ever had thoughts about self-injury or suicide. That surprised me a little bit, but she said that asking was a common part of an assessment for everyone. My initial fears completely disappeared in the first few minutes. I felt so relieved. It was really comfortable to talk to her. I don't know why I was so worried. In the end, we discussed a lot of different options for what to do next. She helped me make a customized plan. For me, my plan included individual therapy with a counselor on campus. However, there are so many options. She let me know that if I didn't feel comfortable working with her, that I also had the option to work with another counselor. Dr. S and I are a good fit though, so we decided to stick together. My next scheduled appointment is a week from today. After I left, I thought about all the advantages of going to counseling on campus. I mean, they're experts. Basically everyone there has years of experience and training. I also thought about how all of my concerns were sort of off base. I didn't have to lie on a couch. Turns out, I'm not alone, and it has given me a ton of hope. Sometimes it can be challenging, but I know it's a process, and I should try to keep it going. I've now gone to 3 sessions. I've learned a lot about myself and how to better regulate my emotions. Dr. S provided things for me to work on in between sessions, and I am getting stronger every day. I'm looking forward to seeing what comes out of this. We have about 3 more sessions before we reevaluate my progress. So, that's how it works. Counseling works for a lot of students. Find out if it's right for you.
This is a typical story. Most students attend 4 to 7 sessions. Services may vary, but all campuses offer crisis urgent care, individual, and group therapy. Check with your campus for additional services offered. Most services are free for registered students.